Today I am joined by Dr. Christina Moradian, who is here with the Mary and Dick Allen Diabetes Center at Hoag, and she is a nurse practitioner. Well, Christina, thank you for joining me. How are you doing?
I'm doing so good. How are you?
Good. I appreciate you taking the time to talk with us. I know things have gotten a little chaotic these last few months, but hopefully it's not been too draining on you.
Oh gosh. Well, I've actually been okay. Personally, I'm fine. With our patients, it's been draining for them actually. Yeah. So they've been affected by it emotionally, I should say.
No, exactly. And, our residents are the age of 55 and over, averaging about 72, 74 years of age. So we've heard a lot about the concern,
Yeah.
not so much about them staying at home, but what happens when they do stay at home,
Right.
and an isolation, depression type of issue. So I'm imagining you're probably dealing with that. But before we get into that, maybe you could give us a little background on who you are and what you've been doing.
Okay, thank you. So as you said, my name is Christina Moradian. I'm a nurse practitioner at the Diabetes Center. That's the Mary and Dick Allen Diabetes Center in Newport Beach. And then we also have another office in Irvine. And I've been here for not very long. Actually, it's about close to going on 4 months now. But I've worked at Hoag Hospital for more than 15 years. I took some time away from Hoag and worked in a private doctor's office, internal medicine, where I specialize. My specialty is in geriatrics, adult geriatrics. So I took care of a lot of patients who were in the older population, but also a lot of our patients had diabetes, both type 1 and type 2. So I managed the diabetes and their comorbidities, which can be vast. So a lot of different types.
Well, exactly. And when you say comorbidities these days, it really kind of sends a little bit different message, because with COVID-19, many of the people who have been truly affected by the disease is those with comorbidities.
Yes.
So in your line of work, what is it that is really at risk? Is it those with comorbidities? Is it certain comorbidities? What has been your experience?
Okay. So in a nutshell, okay, I would tell you that, first of all, anybody who has diabetes, it doesn't mean right away, bingo, you are now going to get COVID. But what it does mean is that it does put you at a higher risk if your diabetes isn't managed. Right. So if your diabetes isn't controlled, those issues of high blood sugars, fluctuating blood sugars, whether they go too high or too low, that does put you at a higher risk. And that risk being that it affects your immune system, it affects your circulation. So those things, we need that good circulation, right? And we need to have a strong immunity. And if we don't have those things, because our diabetes is not well managed, then of course, it does put you at risk. And the risk it can be severe. So you really have to be cautious. And I don't want to scare people. Honestly, I don't. I just want them to continue to be smart about it and make good decisions. And don't get overwhelmed, because I hear that and I see that. And I get nervous for my wonderful patients who I've actually seen during telehealth who have anxiety attacks. I mean, and it's warranted, because they watch so much news, or we all do. I'm guilty of the same thing. I'll turn the TV off, honestly, and I'll listen to music or just go for a walk with my dogs or something to distract me. Anyway.
No, that's great. I mean, it's good that you identify that, because, saying that if you have managed diabetes, then your risks are way lower, which I think is very important for everyone to know, because of course, all you hear about, as you mentioned in the news, is that people with these specific comorbidities scare everybody half to death.
Right.
And we need to be the people, you, me being in the television industry, being able to just dismantle, I think, some of the myths that are out there right now revolving this disease. So thank you for that information. That's perfect. How has your practice changed because of the social distancing and just the general quarantining with this disease and coronavirus?
Okay. So specifically in our office, they're very good about managing when patients come in. We check their temperature right away when they cross that threshold that they're at the entrance. Check temperatures, ask for symptoms, and we ask that the patients put a mask on. We ourselves get our temperatures checked when we arrive at work, and the same questions are asked of us, and we wear our masks. Social distancing is very important. Washing our hands, all the things that you've heard about from the CDC, those are the recommendations that we abide by as well. In terms of being with our patients one-on-one, we again wear our masks. Most of the time, we've kind of slowed down in terms of our telehealth. In the beginning of COVID, it was majority, everything was telehealth. The entire hospital became telehealth, which was crazy. It got a little very busy with our technological people, and so. But anyway, we accomplished that, and it went very well. And the experience turned out really good for both our patients and ourselves. But so we are slowly having our patients come into the office now, and as I was saying, social distancing. And when we're in the office, we wear our masks. They wear a mask, and we wash our hands, before we see them and afterwards. And sanitize. We sanitize the area afterwards, making sure in between patients that it's clean.
Well, that's good. I mean, I know that several of the hospitals in our area are coming back to somewhat of a normalcy.
Right.
However, we are still seeing COVID-19 cases.
Yes.
So, they are on the rise a bit,
Right.
which we expected. But again, we have to look at the numbers of how many people get it and recover just fine.
Right.
So,
And now I just want to reiterate with that. I think people understand that the reason the numbers are going up is because there is so much more testing, right? Now we're opening up the box and we're seeing how many people actually have it or had it and they're immune with antibodies. But I don't want people to also just relax on that. And I don't want them to get too overly, I don't want to say paranoid, but I don't want them to get too afraid, but just, again, common sense. Realizing what's happening and continue to use the same cautions as you did before. And I also wanted to say that, as I was saying, during our telehealth experience with my patients, some of them have exhibited anxiety. And you can reach out to people. We have wonderful behavioral health services at Hoag. So please don't hesitate. Let us know how you're doing. We're always there for you. So just putting that out there. Okay.
That's great. And I like that because I think some people may need that more than others for sure,
Right.
based on their anxiety levels or how.
Or if they're living alone, and they don't have family or friends close by. Yeah, call us. Honestly, we're there for you.
Perfect. Let's talk about how managing, what are the differences in how you manage folks with diabetes as opposed to a younger or more of a middle-aged population?
Okay. So the difference between the two, it's a wide variety of differences. Basically, as you age, things slow down, right? So what does that mean? Well, that means our kidney function slows down, our heart function slows down. You're more susceptible to lung diseases, and I think I mentioned that your immune response is slower. Your reflexes are slower. There's so many different aspects. It's in a lot of ways, it's probably nice because you do get to slow down. I'm sure you want to keep on going, but you get to relax a little bit more and enjoy life. But anyway, so the difference is being the medications are the same, but you're going to be a little more aware and cautious because as we age, we may be taking more medicines, obviously, than someone who's younger. So there are those interactions with different medications. And as I said, because of our body function slowing down, you would make a dose adjustments, right? And then a big thing with diabetes and the older population is the risk of hypoglycemia when your sugars go too low, right? It's a risk for any diabetic. But anyone who's taking insulin or medications that stimulate your insulin, the risk for the elderly and very young as well is the hypoglycemia. And I'm sure that any diabetic person would tell you that when your sugars are low, it doesn't feel good at all. It's scary. So you can actually become unconscious. So there's that risk of fall when you're an elderly person, and not only are you now, in a coma possibly, that's a worst case scenario, or you broke your hip when you fell, right? Or maybe it also causes confusion. So, you can be taking a different medication, and in fact, it may be the wrong one you think is going to help you with your low sugar, but it's not. So there's all these factors, right? So you consider, as a provider, you consider the medications you're taking, and you make dose adjustments. And you also make changes to targets. When you're diabetic, you look at your targets. You want to stay within a certain target. Generally, this is what you strive for. And when you're older, we want to make sure that we don't have that hypoglycemic risk. So we'll adjust that target and not make it quite as strict. And there again, people talk about A1C, right? I'm sure you've heard of that term, A1C. So your A1C is an excellent tool for diagnosing. It's also a tool for checking and seeing how your diabetes is doing as time goes on every 3 months, or 2 months. It could be between 2 and 3 months. But there are these wonderful other tools, and I wanted to talk just for a second about that. That is it's exciting, and it's innovative, and it's cutting edge to a certain degree. They've been out there for a while, but they're always up and coming new devices. And I talked to my elderly population about it, and some of them have those fears. Oh, I don't want it, I don't want something that's technological attached to me or whatever. What I'm trying to get to is something called continuous glucose monitoring. And what it is it's a way to measure your sugars without having to poke yourself, 4, 5, 6, 7 times a day. And also it lets the patient and the provider know how you're doing in real time. Because what it does is it shows and presents these fantastic graphs that let us know if you're in range and how much in range you are in percentage throughout the day.
So in closing, what would do you have a few more things you'd like to say to us just about, the operation, and that people shouldn't be afraid to come in?
That they should not be afraid to come in, is that what you said?
Right.
Yes, please come in. Don't be afraid to come in. We are here for you. It's important that you come in if you're having any symptoms, any problems with your diabetes. And one more thing I'd like to mention is that our center is currently providing some insulin that's free, actually. We have provided this insulin for people that are going through some tough times. Maybe it's because of COVID. We don't, if you're having a hard time getting your insulin, we have insulin available, fast-acting and long-acting insulin. Don't be afraid to come in. Like I said, it's important that you take care of your health, and we are here for you. So that's it.
Excellent. Well, I appreciate you taking the time. You have a great day, doctor, and we'll talk to you again soon.
Thank you so much. It was nice to meet you. Thank you.
You too. Thank you. And we'll be right back after this.